Welcome to the 3030 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Guillermo Ruiz.
Hello everyone, I have some exciting news. In case you missed my Facebook post, I have started seeing patients at Integrative Health in Scottsdale, Arizona under the guidance of Dr. Alan Christensen. For a limited time, I will offer free 15-minute consultations, and I wanted my listeners to be the first ones to know. If you would like a free consultation, please call my office at 480-657-0003 to schedule an in-person or over-the-phone meeting. My guest today is Dr. Robin Miller. Dr. Miller is a physician and author who's been practicing medicine for over 30 years. She is also a medical reporter for nbsp, a local affiliate serving Southern Oregon and Northern California. She is board certified in internal medicine and trained under Andrew Weil as an Integrative Medicine Fellow at the University of Arizona. Dr. Miller is currently practicing internal medicine and serves as the medical director of the Triune Integrative Medicine in Medford, Oregon. Thank you for listening, and I hope you enjoy the show. Hello everyone, super excited to have Dr. Robin Miller on the show. Dr. Miller, how are you doing?
I'm doing great. Thanks for having me.
Oh, thank you for reaching out, and so I received your book. Thank you so much. And there's so many things to talk about because just like you, I am a big fan of lemon balm, Melissa officinalis. I want to get into your Scream Cream.
Yes.
I really want to talk about dance therapy. So I think we have a bunch
that's great.
Yeah, we have a bunch of topics to discuss. But before we start, can you do me a favor and tell my audience your hero story? How did you become Dr. Robert Miller?
Wow. How far back do you want me to go?
Well, you're only, 28? So 28 years.
Yeah, that's it. Uh-huh. Well, I actually got into medicine quite a long time ago, about over 30 years ago. And when I started going into medicine, I was pretty conventional. I did research in preventive cardiology. That was my focus. And then I decided to change and go into practice. So when I went into practice, I was doing conventional medicine as an internist. And when I originally went into medicine, my idea was to help people to heal and become well. But as I worked more and more in a conventional practice, I found that 10-minute visits weren't doing it for me, that I was writing prescriptions for people and I wasn't giving them what they wanted or what they needed, which was actually to talk to them and figure out what was really going on with them. So one day I was in a room with a patient. I'd finished a 10th prescription that I'd written out for her and said, you know what, I'm done. And I quit. And I decided to get into integrative medicine and did a fellowship out where you are with Dr. Andrew Weil, and then started an integrative medicine practice 11 years ago. So my practice is really about forming a partnership with patients. I spend an hour and a half with each new patient, and I actually get to know them. And in doing that, I get to help them. And so we come up with a plan that actually helps them to heal and be well.
It's so interesting, how there are not two systems of medicine. There's only one system of medicine that works. The problem is that when you start getting into the prescription game and you are not solving the actual root cause of disease, you are just patching and not solving anything. Like, for example, if you have someone walk into your office with blood pressure in the 200s over the 100s, of course you're gonna try to lower their blood pressure with some pharmacological agent. But that's not the end of the story. You also need to modify your diet, shorten, mitigate their stress levels, because that's super easy. Just tell your patient, just stop stressing. You gotta do so many things because the blood pressure is not happening because they have an ARB deficiency. No one has an angiotensin receptor blocker deficiency. What we have is a maladaptation to our environment. So in order to truly heal that high blood pressure, we have to correct that. In the meantime, we don't want our patients stroking out, so we'll prescribe that medication. But that's the biggest difference. And if you only have 5 minutes, there is not a lot of investigation that you can do.
No. And I find that as I've done this more and more, I prescribe less and less, and I've actually been able to take people. It's so exciting. Even this past week, been able to take people off their meds because they either stopped drinking alcohol finally after 10 years of talking about it, or they lost 25 pounds, or they got into a great exercise program. This last week has just been revolutionary for my practice. It's just been amazing.
What happened?
I don't know if it's the eclipse or what. I don't know. Finally, sometimes it takes a while for the light to come on for people. And it did. And it's so much fun to take meds off.
It's just like banging at that door, and eventually, it breaks open and everything falls into place. So you decided to become an integrative practitioner, and now you have a book out.
Yes, because as I've been doing this, I've been finding more and more things that I think patients need to be aware of and know about. And I decided it was time to write a book because other physicians are not either aware of it or not changing their practice to start doing some of these new innovative things that make a huge difference. So I actually have a cheat sheet at the end of the book. So if people read it and they want to make changes and they want to ask doctors for certain tests, they can bring the sheet in and it's easy. They can ask for it and then their doctors can see it.
Can you tell my listeners the name of your book?
It's called Healed: Health and Wellness for the 21st Century.
And what are some of the new strategies for the 21st century? Like, for example, let's talk about like stress. What are some things that you like to recommend instead of like anti-anxiety medications or, sedatives?
Well, obviously, dancing is a big part of my book. So exercise, finding an exercise that you like. So most people, when they think of exercise, they don't even try it because they're like, oh, I can't do that. It's just, I'm not good at it. It's too much. But actually, dance is fun and you'll do it and you don't even realize it's exercise. The other thing we talk about is, just getting out and moving like 5 minutes a day, 10 minutes a day, going for a walk. That is exercise. And a lot of people think of exercise as going to the gym, doing lots of weights. It doesn't have to be. Start small.
What people don't realize is that if you have been sedentary for 20 years, going to a CrossFit class might not be the best for you. But starting like a walking regimen with a friend and walking around the neighborhood maybe, and as you get healthier and your energy levels go up, then you're going to want to challenge yourself more. And then maybe you can start dancing, and then eventually that could become CrossFit. But baby steps.
Right. Exactly.
So what is it about dancing that you included in your book and you are really passionate about it? So what is it about dancing that you enjoy?
Well, I didn't start doing ballroom dance until, about 8 years ago. I was part of the Dancing with the Rogue Valley Stars competition that they did for a fundraiser for something called the Sparrow Club. And I did the Argentine tango. I had not done ballroom dance ever, except when I was in 8th grade, and I didn't like it then.
Well, it's icky because you gotta dance with boys. They have cooties.
We had to wear white gloves. It was so icky. It was horrible. But I did this competition, and it was amazing. First of all, it was really fun. Second of all, I noticed that my body changed as I was doing this competition. I got tighter. My balance was better. I had more confidence in myself. I just felt stronger. And I wanted to keep doing it after the competition. So I did. And I kind of ran out of tango teachers. So I started doing something called West Coast Swing. And Dave, my co-author, is my teacher for West Coast Swing. And he and I came across this study actually on Alzheimer's disease, where they took senior citizens, over 400 of them, and they followed them for 5 years. And 124 of them developed dementia. Then they looked back at the activities they had done for most of their life, found out that those who cycled, bicycled, swam, it did not decrease their risk of Alzheimer's. It was 0% decreased risk. However, Reading decreased it by 35%. Crossword puzzles by about 47%. And then there's one activity that decreased it by 76%. And that was ballroom dancing 2 to 3 times a week. So that to me was astounding. And I did notice that my brain works better now that I've been doing the ballroom dance. And you don't have to be good at it.
That's super interesting because all of the different activities that you're talking about are very engaging mentally, like reading, crossword puzzling, but dancing adds like an extra layer of neuronal connections because now you have to tell your brain has to tell your muscles how to move not only in space but also in time.
Right, and with another person, interacting with another person.
And now you have touch, and now you have community, and now you have the oxytocin. So it's like the perfect health storm.
It is. It's amazing. And not just for Alzheimer's. So they've looked at these people with Parkinson's. So when they do ballroom dancing, it bypasses the part of the brain that's damaged, the neural connections. You build new ones, and they actually can move normally, which is amazing. And tango is a really good one for that.
One of my mentors at the Southwest College of Naturopathic Medicine, Dr. Vance Inoue, he's a huge proponent of dancing.
Good.
So he just enjoys it so much. His son is like a professional dancer, and last week it was his birthday. So for his birthday, he made all of us dance. So we did.
I love it.
Yeah, we did salsa.
That's great.
Or merengue, I don't remember. And I have 2 left feet. I'm awful at dancing, but I took my first dance lesson.
Great. Well, you might want to keep it up.
Yeah, and maybe it's not the silver bullet that is going to completely mitigate the effects of Alzheimer's. But if you start adding all of these different things, maybe you are dancing and you're doing crossword puzzles, and maybe you are also eating like a good fat diet. You have, again, those elements of like meditation and touch and community, and maybe by the synergism of all of these different percentages, now your chances of getting Alzheimer's are going to be super low.
Right. And in the book, we talk about the MEND program. Are you familiar with that?
No, I'm not.
So they took, it was a very small study, and they took 10 people with mild cognitive impairment and early Alzheimer's, and they tailor-made a program to each one of them without any of the Alzheimer's drugs. So what they did was, the one woman I give an example of is she was on hormone replacement therapy that was taken off when the WHI study came out and everyone was freaking out about breast cancer. They put her back on her hormones. They put her on a gluten-free diet. They had her meditate. They had her exercise 30 minutes a day. They had optimized her blood pressure, her cholesterol, optimized every piece of her health that she did religiously, and she became normal again. And she's now back at work, and that happened with 9 out of the 10 people. They were able to put Alzheimer's, if you say it that way, into remission by gluten-free diet, healthy eating, meditation, exercise, and making every aspect of their health optimized. So magnesium level, zinc level, all that stuff optimized. And that's amazing.
That's, when we think about Alzheimer's is super scary. I was listening to NPR a couple of days ago, and they had someone talking about ApoE4, how all of the things that people do try to mitigate this effects of Alzheimer's. And to me, it is just like the number one thing that I think of whenever I think Alzheimer's or any degenerative disease is diet. And then you go out from there, and then you have different circles, and you expand the circles and try to mitigate it. It's so frustrating because like you have this NPR, and you have someone with this national soapbox, and they say, well, we've seen some good studies with ketogenic diets specifically for Alzheimer's, but it's really hard to commit to a diet like that because then you have to avoid carbs. And it's just so frustrating because if that saves your life, literally, why wouldn't you do it?
Right. Or if you get your mind back, why wouldn't you do it? Oh, the diet that they used in this study it's called the MIND diet. If your listeners want to look it up, MIND, MIND diet.
Can you give us a primer on what the diet consists of?
It's whole foods, it's gluten-free, and basically lean protein, super healthy, super clean.
It's just frustrating because if you give someone an option, they are going to take the path of least resistance.
Absolutely.
Like, for example, if you have a mom that just gave birth and she's asking the doctor, well, I'm having trouble with breastfeeding. The doctor has two choices. The doctor can say, well, we're going to have to work with you to develop habits so breastfeeding is easier. Or the path B would be, okay, let me prescribe you this formula. This stressed out, super busy mom is obviously going to try to do the best for her kid. But if the doctor is giving you the blessing that you can do formula, more than likely than not, that mom is going to start formula. Same thing with this diet. If we can have doctors actually being more careful about modifying disease processes and modifying habits instead of giving the path of least resistance, which is just usually a prescription. Stop eating wheat, period. And if we're making those decisions and we are addressing them at the beginning of the care treatment, then we will make progress in this messed up healthcare system.
Which is why we wrote this book, because we talk about these things. There are some other simple things that people can do genetically, and I know you focus on genetics as well. The MTHFR gene, are you familiar with that?
Oh, totally, 100%, yeah.
Yeah. So, that's really easy to test for. And if someone has a mutation on that gene, then they're not processing folic acid properly, meaning that you need L-methylfolate, which is what's processed in your gut to make serotonin, dopamine, and norepinephrine. If you're unable to do that because you have either one or two mutations on that gene, and so your levels are down, all you need is L-methylfolate. And then you actually start feeling better. Irritable bowel symptoms may go away. Anxiety may go away. You might just start to feel a whole lot better. And that's something that's really simple. Again, easy to test for.
And then, and on the same note, just like you can have undermethylating genes, you can have overmethylating genes. And if you get your report and you see a couple of mutations and you think, oh, I'll just take methylated vitamins, but you are an overmethylator, you are going to feel, guess what? Fatigue. You're going to confusion. You're going to feel tired. So being an overmethylator presents with the same symptoms as being an undermethylator. So you think you're doing everything right, but then you're not. And that's where practitioners that are well-versed in functional medicine are so important.
Mm-hmm. Definitely. So, there's a lot of simple things that people need to be checked for that might really impact their health. The other interesting thing is the microbiome. And that's another thing that, may help people to understand why they're not feeling so well. Because if you eat crappy food, then you're going to thin your gut, and lipopolysaccharide leaks out, causes inflammation, and makes you feel like crap. So if you eat crap, you'll feel like crap. So what you want to do is eat healthy so that you have healthy bacteria and you'll feel good. A simple concept, but something people, it's really hard to do.
So, okay, so you're basically describing intestinal permeability. Explain it like I'm 5. What's intestinal permeability?
Well, so when you have a microbiome that is unhealthy, it thins the wall of the gut, your intestines get thin, and things leak out that you don't want to leak out. And mostly it's something called lipopolysaccharide, LPS.
So it's like, LPS is the outer membrane of the gram-negative bacteria.
Right.
And the gram-negative bacteria gets recognized by your body as a foreign invader. And then it starts attacking it.
And then you have inflammation.
So if you eat a crappy diet, you basically have poop circulating in your blood. Pun intended.
Exactly. So yeah, you want to have healthy guts.
Exactly, and that fixes so many things. So now that we're talking about bugs, let's talk a little bit about cold sores.
Oh, yes.
Yeah.
So there, I discovered this a long time ago. Lemon balm is amazing for preventing cold sores from coming out. And if you're getting a first time cold sore and you start using lemon balm, you can get rid of it. So they've done studies looking at lemon balm for if you get an outbreak of both either oral or genital herpes. You use lemon balm, it will reduce inflammation, it can decrease the course of the illness or the outbreak by at least 2 days. And there's a great study in Germany that took 3 centers and treated people with new onset herpes, treated them with lemon balm, and the herpes never came back. It's amazing.
I love lemon balm, and the reason I love, like I was telling you before we started recording, is that a lot of my work at SCNM and at the ASU lab has been involving the figuring out the mechanism of action of lemon balm. And so that's something like I've done thousands of experiments where we use in vitro layers of cells, Vero
Yeah.
cells, and we infect them on purpose with HSV1 and HSV2, and then we use the lemon balm extracts in order to try to kill the HSV. And we have elucidated a bunch of stuff here in Arizona. The mechanism of action of lemon balm is very similar to that of Abriva. It binds the glycoprotein receptors, the glycoprotein B receptor, so it encapsulates the herpes virus before it enters the cell. So then the virus can't go inside the cell. I've gone to Barcelona and presented this research, and everyone is so receptive, and they're like, oh, we love this. Whenever you've discovered the pharmaceutical compound, give us a call and then we'll fund you. Because you cannot patent plants.
No, you can't.
So we have studies all over the world that prove that this plant in the Lamiaceae family that grows like weeds is so effective against herpes.
It is.
And yet, because it's not profitable, it's not out there helping people.
Which is why I wrote about it in my book. It's amazing.
And that's the reason, I do this research, because I'm really passionate about botanical medicine. I'm a big proponent of doing the safest, most effective treatment that we can. And anytime that we have something like this, a botanical that has historical evidence, empirical evidence, and clinical evidence, and we are still not using it, that is not evidence-based medicine.
And it's got no side effects, none that I know of.
The only thing that I've seen as a side effect, so Melissa officinalis does bind to heparin receptors. So in super high doses, there's a study I think in dogs, it did cause a little bit of bleeding, but it was like supraphysiological doses, which we would never use unless we purify it and make a pharmaceutical.
A drug.
Yeah.
Right.
So who would have known?
Well, I use it every night. I put some lemon balm ointment on my mouth because I get cold sores. And since I've been doing that every night, I haven't gotten one.
Yeah, that's awesome.
In years. It's fantastic.
And so then, we can look at the evolution of plants, okay? And like I said before, lemon balm is from the Lamiaceae family. So every single Lamiaceae has some degree of effectiveness against HSV. So like lavender, sage, it just so happens that lemon balm has the highest. So that's why we decided to study lemon balm. Have you ever used it for shingles?
No, I have not.
So very effective against shingles too.
Huh. So you just put it on the shingles lesions?
Yeah. So we did an extraction and we put it on a gel, and you just put it topically on the shingles, so my research is in vitro, so I cannot 100% assume as a scientist that the dispersion by ingesting it orally is going to be equal to something that happens in vitro. So as a scientist, we have really good data on topical applications. But you, as a clinician, have you seen that it works orally?
No, I don't use it orally.
Not at
I
all.
just use it topically.
Yeah.
Hmm.
So yeah, and maybe in the future, that would be the next way of the next step in investigating this plant, just to see diffusion, just to see renal toxicity. I don't know how it's being eliminated in the body, but it's very important that imagine if we could make a topical or a something that you take orally that attacks viruses even before they penetrate the cell.
That'd be great.
Yeah, so it would be fantastic. So cold sores, let's remove obstacles to health. So we get rid of them with lemon balm. But stress is another cause for cold sores.
Yes.
So what are some recommendations that Dr. Miller has for stress, other than dancing?
Well, exercise is key. Obviously, we talked about that earlier. Healthy diet definitely helps with stress. So if you eat, again, you don't have a healthy diet, you could easily get stressed out and depressed. And that gets us back to the microbiome again. And the healthier you eat, the better you're going to feel. And there are certain nutrients that will help you feel better as well, like vitamin D, vitamin C. To get all those things balanced are really important because it'll help you deal with stress better, because we all will get more agitated if we feel horrible. And they've done some really interesting studies in mice on the microbiome and obesity and stress and anxiety. And the most interesting is the one they did with mice, where they took a fat mouse, painted skinny mouse poop on the leg of the mouse, and the mouse actually lost weight once it licked the poop off and had essentially a fecal transplant.
Wow.
And so the mouse lost weight, but the mouse also got anxious. So I do think the microbiome is also influencing our behavior, our anxiety, and our reaction to stress. So again, it comes back to all the things we knew from our mothers when we were growing up, that healthy eating is really important. And I think it's really interesting how things are coming around again. So what's old is new and what's new is old. It's all going to come back to healthy eating, exercise, getting outside, enjoying the fresh air, and staying away from the news. That's my advice.
Now, the problem is this, though. Maybe 50 years ago, okay, when what the advice that moms were giving kids, drink your milk, but it was grass-fed milk because we didn't have as big as a CAFO, organizations. Eat your butter because it was real butter. Finish your plate. Portions were smaller, and vegetables actually had nutrients because the soil wasn't completely generated. Mm-hmm. So then those kids grew up and had kids, and in the 80s we started demonizing cholesterol, we started demonizing meat, we started demonizing. So then it became, finish your toast and it has margarine. So it has devolved. The old becomes new. But right now, with the ancestral movement, with the Weston A. Price Foundation, with the paleo community, what's new right now, we're talking about like what was hundreds of years ago. We're trying to go back to the way things were originally.
Exactly. There was a television show where they put people back on the prairie and took all the modern conveniences away. So they had to be like people were in the late 1800s. And there's this one character, a real reality character, who started losing a ton of weight, and he thought he was dying. And so he had to actually pay for the doctor, which was very expensive back then. The doctor comes and says, "You're losing weight because you're exercising all the time, because you're working on the land, and you're not eating a lot because you're not producing a lot. And so you don't have cancer at all. You're just healthy."
You have the disease of health.
Right. And he goes, "Oh yeah, I guess I do feel better."
Now, if he could only added some dancing to that mix.
That's right. Maybe he was dancing at night, because what else was he going to do? He couldn't watch television.
You couldn't watch the news.
That's right. So, yeah, so I think that, stress can be handled if, again, we take care of ourselves and we do what we need to do, eating healthy, exercising, staying away from things that stress us out, and optimizing our nutrients.
So, another thing that stresses people is, age. And there is a certain level of aging that we naturally and physiologically do. There's a lot of buzz out there about anti-aging medicine. I know that increasing your hormones in to physiological levels is important because that can be stressful for you, for anyone. If you're not having a healthy sex life and if you're not having all of that stresses you. So first of all, you did mention that there was the NIH study about hormone replacement. What are your thoughts on hormone replacement therapy, first of all, and then we can talk about other things that you can do in order to enhance your life.
Right. So I actually co-wrote another book called The Smart Woman's Guide to Midlife and Beyond, and I talk about hormones in that one. And I talk specifically about the Women's Health Initiative that scared women into not doing hormones anymore. But what you need to understand with that study is what they did. So they took women who on average were 63 years old. They specifically took women who'd never had a hot flash and had been menopausal for probably about 10 years. And they did that because they were going to treat them either with Premarin and Provera, which are hormones. Premarin comes from horse urine, pregnant mare urine. Provera is progestin. It's not progesterone. It's a synthetic form of progestin. And they were either going to give them that or placebo. So they took women without hot flashes, figuring that they would not know whether they were on the treatment group or the placebo, because obviously the hot flashes aren't an issue. Must have been men that designed this study. Because you put women on hormones who haven't seen them in 10 years, they're going to bleed. And that's what happened. So right off the bat, a whole bunch of women dropped out. So your treatment group is small. So there was another group that got Premarin alone because they had hysterectomies and they felt like they didn't need to give them progestin because they didn't have to worry about buildup of the endometrium. So the women who were on Premarin and Provera, those were the women at increased risk for breast cancer, and I think there was some increased risk in dementia, whereas the women on Premarin alone did very well. There was no increased risk of breast cancer, especially initially, no increased risk for heart disease or dementia. So I don't think it was the Premarin. I think it was the Provera that was the culprit in the problem with them. And we don't use, I never use Provera, ever, ever, ever. I just use natural progesterone in my patients. And I don't use Premarin either. I use natural bioidentical estrogen. And I think for most of my patients, it's really important to put them on the hormones, especially if they're symptomatic from menopause. If there's a risk of breast cancer and they don't want to go on the hormones, then I find all kinds of interesting alternatives that we can talk about. But for me, I think it helps with vitality, skin health, certainly bone health, and it helps prevent colon cancer. So if you have a woman who's at high risk for colon cancer and osteoporosis, I think hormones are a really good thing.
And method of administration is also very important.
Right.
Because can you talk about conjugation and blood clotting?
Right. So if you give hormones under the tongue or through the skin, then you don't have to worry about blood clots. There's no higher incidence of stroke, heart attack, any of that. So I rarely ever use oral estrogen or progesterone. I'll give it sublingual or I'll give it through the skin. And we even do it intranasally now, which is kind of cool.
And what happens when you take a pill and actually ingest it?
Well, it goes through the liver, and then that's where you end up having problems with blood clots.
Yeah, because your liver's trying to detoxify it.
Right.
So it's overworking and it creates, that's what creates the blood clots and it creates problems. So doing a parenteral administration of these hormones is much safer. And then you add the level of, I'm using bioidentical hormones. And then you are doing it within physiological levels.
Right.
And you're not going to the point where women that haven't had a period in 10 years are going to start bleeding again.
Right, exactly. And I really watch the levels carefully, and I look for the mid-range, which is what is recommended. And for the most part, I've had no issues with it with patients, and I highly recommend it if someone doesn't have high risk for other diseases like breast cancer, or obviously if they have the, BRCA1 or 2 mutation. I would not put them on
Of
hormones.
course, it's common sense.
Right.
Yeah, and but what are the things that you can do in order to enhance someone's life?
Okay, so some people, they can't be on hormones, or they've had treatment for breast cancer, or they're on drugs that sort of dull their sex drive, or their sensitivity.
So, what are some of those drugs?
Antidepressants are the big ones. The SSRIs, they do it to you.
And that's what I want to get to. Okay, so you have someone that's depressed. They might not have any libido, okay, because they're not on an SSRI, which causes depression. So it's like this self-feeding loop. So the people that are on antidepressant, the people that are clinically depressed, are probably the most apt to have this problem.
Right. So in the book, I talk about this patient. It's a good story. So it was a patient who had a stroke. She got over the stroke, but oftentimes people will get a little depressed after a stroke. So I put her on citalopram as an antidepressant, a low dose. And this woman who had had an active sex life, just loved having sex with her husband, totally enjoyed it, suddenly didn't enjoy it anymore. So we came up with a cream, which is a combination of Viagra, theophylline, and arginine, all those things that dilate blood vessels, and had her apply it to the clitoral area and wait, just like men do, for 45 minutes. You have to wait or it doesn't work. And it just totally changed her life. So much so that they decided to go on a second honeymoon, went to Hawaii, were whooping it up so much that the security was banging on their door thinking that somehow she was getting beaten. And that's why it's called Scream Cream. And it's completely safe. I mean, there's no downside to it, and it will restore you, for many people, to when they were 16 years old in terms of sexual responsiveness. It's pretty amazing.
Wow. And so you get that compounded, of course.
Yes, it has to be compounded. Some compounders will use nitroglycerin instead of the aminophylline or the theophylline, but I think it gives people headaches. So we do Viagra, arginine, and aminophylline or theophylline.
That's so amazing, and not only is it, it's the Viagra, which is, proven to cause vasodilation, but does it stay? It doesn't go systematic.
No, it doesn't. And there's no downside to the cream in terms of, if you've had breast cancer or whatever, doesn't matter. There's no hormone in it.
Wow, that's amazing. So did you come up with this formula on your own, or did you do some research, or how did you come up with it?
I wish I had, but I didn't. I work with this amazing compounding pharmacy, and they actually, I talk to them about issues I have with my patients, and then they come up with solutions. This one they'd had before. They just told me about it. But it's pretty cool being able to work with compounding pharmacists, because we've done some very interesting things together.
So imagine a world where your pharmacist, who is the expert on drugs, and your doctor, who is the expert on diagnosis, talk, and they are on the same level, and they can come up with awesome solutions for the patient. Isn't that just like the future of healthcare?
Oh, I hope so. It's pretty amazing, actually. We did something that's not in the book that you might be interested in, which is using curcumin to kill HPV, human papillomavirus.
Wow.
And we're working on that right now, actually, where I read the study that showed there's a cream that was made that you could use it vaginally, and it could reverse dysplasia in the cervix from HPV and get rid of HPV. So again, I went to my compounding pharmacist and I showed her the study. And so she came up with a solution, which are these little orange bullets of curcumin that women use vaginally for a month. And so we've given it to, I think we've had 8 women so far. Their HPV is gone. Their pap smears are now normal, and we're continuing to study it in other women. It's amazing. There's been no irritation, no problems. The only thing is it's a mess.
No, it's a
You have to wear Depends for a month. It's gross. And
yellow mess.
yes, and it comes off on the skin. It's absorbed through the skin, and it creates like this frost. So I thought about that, and I thought, wow, if it's coming out on the skin, maybe it would help with psoriasis. So we've been using it on people with psoriasis, and it's been helping them also.
And how do you compound that? Do you
Well, it's the same way, only if it's a guy, we have him use it rectally.
what about for psoriasis?
Same thing, same amount. It's 1.5 grams of curcumin.
Really? And it
Yes.
goes like psoriasis, like in your face?
Psoriasis on your whole body.
Really?
So we've been trying it on those patients. The men aren't as good as trying it on a regular basis. Women are much better at that.
I wonder, what is the curcumin doing? Because it's basically the same pathology. You have hyperreplicating cells.
Right.
Psoriasis, you have a lot of keratinized cells, and then you have HPV, which is a viral cell that was infected, and the virus took over, and now they're just reproducing super fast.
Yeah, it kills the HPV. It's amazing. And so we treat the male partners with the rectal suppositories and hope no one's gotten it back.
Wow. So I have a proposal for you right here on the show. I do have HPV cell lines. So if you ever want to run any in vitro studies with this compounding, you send me some samples, blind them
Okay.
for me, and then I'll see, and maybe we can investigate mechanisms of action and
Yeah.
dosages.
That'd be great.
Yeah, that's such an amazing experiment, because HPV is in the same family DNA virus as HSV, HIV, all of those, they're all DNA viruses. So Melissa officinalis, okay, it's not as effective against HPV, but it has some effect on HPV too.
Huh. Interesting.
Yeah, because it just think of it evolutionarily. All of this had a common parent, and they evolved into different virus families. So HPV does use glycoprotein receptors too. So using lemon balm helps with that too.
Cool.
Yeah, so it would be super amazing, because now you can add synergism. Because let's say that lemon balm works by attaching itself to the glycoproteins, but curcumin, I don't know, changes the way the DNA replicates. So now you have two different mechanisms of action from two different plants, creating true synergism that will help you get better from that viral infection faster.
Huh.
Yeah.
Interesting.
Very interesting. Very interesting. Well, Dr. Miller, so what's the name of the book again before we go into hashtags and stuff?
It's called Healed, Health and Wellness for the 21st Century.
And where can we get it?
You can get it at wellhealed.net or amazon.com.
Excellent. And what's your website?
Our website is wellhealed.net.
Are you open for clients right now? For patients?
Oh, yeah. I'm always open for patients. Yeah.
Yeah. So how can patients get a hold of you if they want some scream cream, or if they want to dance Alzheimer's away?
They can find me they can email me at drmiller@triunemed.com, or I actually have a website for my clinic, triunemed.com, triunemed.com.
And do you do any Skype consults, or is it all in person?
I have not been doing Skype consults.
Okay.
You never know in the future if I might, but so far you got to come see me.
And
at least once.
And yeah, at least once. And legally,
Yes.
you literally you have to go see her at least once.
Right.
But you get to go to California.
Oh, I live in Oregon.
Oh, you're in Oregon. So
yes.
So you get to go to Oregon, and before we started this interview, she showed me her vineyard.
Yes.
And you have
gorgeous.
A beautiful vineyard where I've seen some videos of you dancing in front of the vineyard.
Yes, that's right.
Yeah, so so go visit Dr. Miller. Go pay her a visit, eat some grapes, and then get healed.
Thank you.
So thank you so much, Dr. Miller, for the interview. I hope a lot of people find a lot of help in this with this conversation. And I'd love to have you back in like 6 months, maybe open it up to Facebook, have people submit their questions, and then maybe you can answer some questions for them.
That would be wonderful. I would love that.
Awesome.
Thank
Well,
you.
I will see you again then.
Okay. Thank you so much.
Talk to you soon.
Okay.
Bye-bye.